and I talk HIV infection and infectious mononucleosis. The HIV, or what is called AIDS, it is caused by human immune deficiency virus, HIV-1 and 2. Most common in children, it is HIV-1. HIV-2, it is a rare cause of infection in children. This virus is a single-strand RNA virus. Few notes about the structure of this virus. This virus contains an external layer, and this layer contains many glycoproteins. طبعا كل glycoproteins إلى وظيفة معينة. In general, it has important immunologic response to detected antibody for diagnosis, like glycoprotein 41, glycoprotein 24. Also, we have glycoprotein 120. Glycoprotein 120, it is contain the binding site for the T lymphocyte, and the target of this virus when into the human body, it is the T lymphocyte, اللي هي CD4. So the virus will attach to the T lymphocyte by this glycoprotein 120. Also, there is reverse transcriptase and RNA of the virus. How the HIV virus work and how it is affected the T lymphocyte in the body. When this virus enter into the human body, the target, as we say, it is the T lymphocyte, which is the CD4. The virus attached to the T lymphocyte by glycoprotein 120. In the presence of reverse transcriptase and RNA of the virus, it will make a new DNA. This new DNA will enter inside the nucleus and integrated with the DNA of the host cell. The red color هو new DNA, which is synthesized by the virus, والgreen هو host DNA. After this integration, it will produce new viral particles, and this new viral particles then will be redistributed to the circulation and infected another T lymphocyte. In general, WHO, we estimated that more than 35 million persons were living with HIV infection at the end of 2013, and 3.2 million were children, and most of them vertical transmission from HIV infected mother. In 2001 alone, 5 million people acquired HIV infection and 3 million will die. This is in all words. How the HIV infection can transmit to the human, to the children. Mainly in children, transmitted infection by vertical transmission, which is mean from mother to the child. It is either intrauterine, يعني during pregnancy عن طريق البلاسنتا, or intrapartum, which is mean during delivery when contaminated with amniotic fluid or blood from the mother, or through breastfeeding after delivery. Because this virus, HIV virus, excreted in the breast milk, so can get infection after delivery by breastfeeding. This is the main method for get infection in children. The other less common by parenteral exposure to blood or blood products. إذا طفل need blood transfusion, this blood contain the virus, it will get infection, or by blood product like plasma or cryo. The less common route of transmission by sexual contact, this is mainly in adolescent. Clinical manifestation of HIV infection, we have many clinical manifestations because affected all organ in the body. At birth, neonate can be normal at birth, but most commonly have signs and symptoms. The most common clinical presentation was generalized lymphadenopathy, hepatosplenomegaly, failure to thrive, chronic or recurrent diarrhea, and oral thrush, severe oral thrush. Also, there is recurrent bacterial infection due to low immunity. As we say, this virus affected the T lymphocyte, so it will affect the immunity and lead to immunosuppression in this child. This is lead to recurrent bacterial or viral infection. Also, there is a chronic parotid swelling. إذا تتذكرون محاضرة الممس واحدة من الديفرنشال diagnosis of parotid swelling إنه هو ال HIV infection. It causes chronic bilateral parotid swelling. Also, 20% of children with HIV show recurrent bacterial infection, like most commonly streptococcal, salmonella, pseudomonas, and H. influenza. Other bacteria common was atypical mycobacterium infection, which is Mycobacterium avium complex, fungal infection, which thrush or oral candidiasis. Also, common infection is pneumocystis carinii pneumonia. This is more common in children less than 1 year of age. The common viral infection in the HIV child is herpes virus, which causes recurrent gingival stomatitis. طبعا هذه تكون painful lesion وممكن تأثر على eating of the child with time. Also, varicella zoster, which causes chickenpox, cytomegalo infection. Common respiratory manifestation, otitis media or sinusitis is very common. Lymphocytic interstitial pneumonitis, which is the most common chronic lower respiratory abnormality in HIV child, and streptococcal pneumonia. GIT manifestation is common as pseudomonas, candidiasis, ulcerative gingivitis, giardiasis, salmonellosis, or disaccharide intolerance. Renal disease common in infectious in HIV child is nephrotic syndrome, which is the most common manifestation of pediatric renal disease. This child with HIV infection, and here we see the oral thrush, severe oral thrush, which is caused by fungal infection, candidiasis. Also, skin manifestation in HIV is seborrheic dermatitis, eczema, enogenital wart, and molluscum contagiosum. The most common hematological manifestation in HIV child was anemia, which is occur in 20 to 70% of children. Also, there is leukopenia, which is decreased white PC count in 1/3 of cases, thrombocytopenia in about 10 to 20%. There is bone marrow suppression. Non-Hodgkin lymphoma and primary CNS lymphoma are the most common neoplasm among HIV child. This is seborrheic dermatitis in the lower limb, in the leg of child with HIV. How we diagnose HIV infection? First, we can do serologic test to detect HIV antibody, and this is done at birth. If mother is affected, as we say, the most common route for get infection from the mother, intrauterine during delivery or after delivery. So we do HIV antibody at birth if the mother is infected by the virus, and we should repeat after 18 months. Why? Because even if the child is not infected by the virus, it will be positive antibody. During pregnancy, the Maya already HIV infection, so the antibody will pass through the placenta into the fetus. So at birth, even if the child is not infected, this antibody will be positive. To sure if this really infection or طبعا هذه الانتيبادي راح تبقى عند الطفل about 18 months, then will be disappear if not infected. In order to sure if there is infection or not, we repeat the test after 18 months. إذا عندنا ال HIV antibody after 18 months and the child is positive, so it is infected. In order to sure نريد نتأكد إذا الطفل كان مصاب أو لا قبل ال 18 months, we do another test. We can do HIV DNA PCR, HIV RNA PCR, and we do HIV culture. This is used to detect HIV in children less than 18 months of age. About treatment, طبعاً clinical manifestation of HIV is many manifestation, بس احنا اختصرناها للسهولة. most common هو important manifestation. About the treatment of this infection, the current available therapy does not eradicate the virus and cure the patient. يعني أنت من تعطي العلاج للمريض أو للطفل اللي عنده HIV. This is not eradicate the virus and not cure the patient, but it is suppress the virus for extended period of time and change the course of the disease to chronic process. مجرد إنه تخلي الفيروس suppress ونغير ال course of disease to the chronic process. We have many antiretroviral therapies. احنا اختصرناها فقط ال most common groups. So example on each one. The first group called reverse transcriptase inhibitors, وهذه تشتغل على الريفيرس transcriptase اللي ذكرناه واللي يدخل بتكوين النيو DNA. We have two groups, nucleoside reverse transcriptase inhibitor, which is common drug here, lamivudine and zidovudine. The other هو non-nucleoside reverse transcriptase inhibitor, which is include groups what is called the protease inhibitors. We have some side effects for this drug, but not mentioned in this lecture. So the first line, we give antiretroviral therapies. The other line of drug, which is important in the treatment, is supportive therapy. The first is nutritional support. As we say, the child will have failure to thrive. There is chronic or recurrent diarrhea, also recurrent bacterial infection. All these lead to time for malnutrition. So we need to do nutritional support with vitamin supplements. Also, oral hygiene is important in this child due to there is oral candidiasis, dental caries is common, painful lesion, oral lesion like gingivostomatitis, which is decrease the eating of the child. So attention for oral hygiene is very important. What about immunization? يعني إذا إحنا الطفل أول ما ينولد at birth هو مصاب عنده HIV infection، زين هذا الطفل أنا راح أنطي له لقاح أو لا؟ We have two types of vaccine. As we know, there is live attenuated vaccine and cold vaccine. Cold vaccine we can give to the child without any harmful effect. يقدر ياخذها ما عندنا مشكلة الكولد vaccine. About live attenuated vaccine, this is depend on the type of the vaccine. About oral polio vaccine, the oral polio vaccine هو live attenuated vaccine, so it should not give in patient with HIV due to first low immunity and poor immunization response to the vaccine, and also it can cause poliomyelitis اللي هي vaccine associated ذكرناها بمحاضرة البوليومايلايتس نسميها vaccine associated poliomyelitis due to it is immune suppressed. So it is contraindicated for give oral polio vaccine. Instead of it, we give inactivated polio vaccine اللي هو other type. This is can be given for this patient. The other live attenuated vaccine هو BCG. The BCG should not be given for patient with HIV because it can cause TB infection. MMR vaccine, which is measles, mumps, rubella, and varicella vaccine, this also live attenuated vaccine. Give to the patient or not, this depends on the condition of the patient. يعني إذا كان الطفل هو severe immune suppressed So don't give this vaccine. If no, the patient is stable, not severely immunosuppressed, we can't take these vaccines. Due to these disease have many serious complications. فهنا راح نعتمد على the condition of the patient. What about breastfeeding? As we say, this HIV virus excreted in the breast milk. إذا الطفل أول ما ينولد أنت سويت له investigation، الأمية كانت مصابة positive HIV infection، الطفل أول ما انولد سوي لنا investigation طلع الطفل ما مصاب. إذا هنا راح تخليه on breastfeeding أو توقف الرضاعة وتخليه على bottle feeding. هنا راح نعتمد على الكاونتريز. In developing countries, the poor countries like Africa، يعني الدول الفقيرة مثل أفريقيا، risk of malnutrition and pneumonia is very high, and there is no clean good water source. يعني احنا نحتاج إذا تخليه على bottle feeding لازم أكو good water source for formula feeding. There is no good or clean water source in these countries is available. وممكن يتعرض البيشنت إلى chronic recurrent diarrhea. So we continue on breastfeeding. In developing countries نبقى نستمر على رضاعة الأم، وهنا طبعا إذا الطفل ما مصاب ينطوه بروفيلاكتيك أنتي ريتروفيرال ثيرابي اللي هو الزيدوفودين اللي ذكرناه put on this drug during the period of breastfeeding as prophylactic. While in developed countries يعني الدول المتقدمة النامية العفو المتقدمة there is a good source and clean water source. يعني عندهم متوفر انه هو تقدر توفر للطفل clean water for formula feeding. ما عندنا مشكلة. إذا هنا we stop breastfeeding and put the child on the formula feeding in developed countries. A prophylactic antibiotic, sometimes we need to give antibiotic as prophylaxis to protect from common bacterial infection. We can give trimethoprim sulfamethoxazole for those children less than 1 year due to risk of pneumocystis carinii pneumonia. Also, we can give azithromycin for as prophylactic against Mycobacterium avium complex. This we give for a child who is immune suppressed and less than 1 year. We have some instruction we should give to the parents of the affected child in order to decrease opportunistic infection. احنا قلنا الطفل يكون low immunity, more liable for many opportunistic infection. At risk of this opportunistic infection, we give some instruction for the parents, for the family. Like good hand washing is important. Avoid eating raw or undercooked food due to risk of salmonella. Avoid drinking or swimming in river water. يعني مياه النهر اللي تكون مو نظيفة المفروض يتجنب السباحة أو الشرب من هذه المكانات. Avoid contact with farm animals due to risk of cryptosporidium, and avoid playing or contact with pets, especially cats, due to risk of toxoplasmosis. This instruction is important for the family to decrease risk of opportunistic infection. Other infectious disease I talk about today is infectious mononucleosis, or what is called glandular fever. It is caused by a virus called Epstein-Barr virus, and the route of transmission into the human by oral secretion, such as kissing or exchange of saliva from child to child. And the virus will be shared in oral secretion for more than 6 months after acute infection. Also, this virus will found in the genital tract of the women and may be spread by sexual contact in adolescent or an adult. المين route of transmission to children by oral secretion. This virus will initially infect the oral epithelial cell, as we say, transmitted by oral secretion. So it will infect the oral cells and then will be enter into the blood, will cause viremia, then will be reach and infected B lymphocytes, which is found in the peripheral blood, and they reach into the whole reticuloendothelial system, to the liver, to the spleen, to the lymph nodes. Epstein-Barr virus was the first human virus associated with malignancy in the humans, like nasopharyngeal carcinoma, Burkitt lymphoma, or Hodgkin disease. After an incubation period, which is about 30 to 50 days, there will be prodromal symptoms like malaise, fever, fatigue, headache, sore throat, nausea, and abdominal pain. This is the main presentation will appear, and this is lasting for about 1 to 2 weeks. There will be then rapid splenic enlargement, huge splenomegaly, which is causing left upper quadrant abdominal discomfort and tenderness. On physical examination, when I examine a child with infectious mononucleosis, what the sign I find in the examination? There will be generalized lymphadenopathy in about more than 90% of cases. There is splenomegaly in 50% of cases, hepatomegaly in about 10% of cases, epitrochlear lymphadenopathy. Also, there is hepatitis and jaundice, but this is uncommon. The most common هو generalized lymphadenopathy. There are also sore throat, pharyngitis with marked tonsillar enlargement and exudate. As we see in this picture, there is obvious cervical lymphadenopathy with other clinical manifestation. This is also tonsillitis with exudate formation. This is white layer, هذه هي exudate with tonsillar enlargement and pharyngitis. Maculopapular rash also occur in about 3 to 15%. Edema of the eyelids present. In 80% of cases, autoimmune mononucleosis will experience rash if treated with ampicillin or amoxicillin. يعني إذا هو الطفل عنده infectious mononucleosis وعنده fever الطفل ياخذ علاج مثلا أخذ ampicillin or amoxicillin. In 80% of cases there will be a rash in the whole body. As we see in this picture, this is a case of infectious mononucleosis. Take ampicillin or amoxicillin. This is lead to appearance of this maculopapular rash on the whole body. For diagnosis of this viral infection, we first depend on the typical sign and symptom. We say there is atypical lymphocytosis, which is about 20 to 40% of the total number. Also, there is leukocytosis and specific test to detect the infectious mononucleosis. This is a blood film showing the atypical lymphocytes. هذه البيربل كلر هي الاتيبيكال lymphocyte. الاتيبيكال يعني تكون الشكل مالتها abnormal، والنيوكليوس تكون large nucleus مقارنة بالتيبيكال lymphocyte. هذه نسبتها ممكن توصل 20 to 40% from T lymphocyte الموجودة. Specific test to detect this infection, which is called Ball panel test, and this will detect the heterophil antibodies, which is Ball panel antibodies. Titer greater than 1 to 28 or 1 to 40 consider positive. حسب التايتريشن، حسب المختبر يعني تختلف النسبة. Also, we can do a serologic test to detect the antibodies against the virus, which is acute phase antibody IgM, and they're replaced by chronic antibodies, which is IgG antibodies. About treatment of this viral infection, we have no specific treatment for this virus. High dose of acyclovir with or without corticosteroid can decrease viral replication and oropharyngeal shedding, but does not reduce severity or duration of symptoms. يعني انت حتى لو تنطي acyclovir اللي هو انتي فيرال drug او تنطي corticosteroid ما راح يقلل لك السيفيريتي اوف ديزيز او الديوريشن اوف سيمبتومز، مجرد انه هو يقلل لي الفيرال ريبليكيشن. Symptomatic therapy and bed rest is important, like antipyretic agents, IV fluid if needs. We should avoid abdominal trauma in order to avoid splenic rupture. As we say, there is rapid enlargement in the spleen, and the spleen will become friable and can be ruptured by any trauma. So you should avoid any abdominal trauma. Avoid exercise for about 2 to 3 weeks. And also this is to avoid any rupture of the spleen. We have some indication for corticosteroid. يعني احنا مو كل مريض عنده infectious mononucleosis أنطي corticosteroid. We have some indication. From this indication is airway obstruction. As we say, there is pharyngitis, there is sore throat with exudate and membrane formation. This can cause airway obstruction. In this case, we can't give the corticosteroids. Other indication, if there is thrombocytopenia with hemorrhage. In case of autoimmune hemolytic anemia. Also, when there is CNS manifestation like meningitis and seizure. In these cases only we give corticosteroid in the infection. And the recommended drug and dose, we use prednisone, 1 milligram per kg per 24 hours for 7 days, and then we taper over another 7 days. يعني total duration of therapy 14 days. First week 1 milligram per kg, while second week we taper the dose over 7 days. Lastly, we have some complications for this viral infection. And first important complication, splenic rupture during the second weeks mainly, airway obstruction and tonsillar swelling, ataxia and seizure, CNS complication like meningitis, facial palsy and encephalitis, Guillain-Barré syndrome. Guillain-Barré syndrome is type of peripheral neuropathy. Hemolytic anemia, which is positive Coombs test anemia, which is mean autoimmune hemolytic anemia due to autoantibodies. Also aplastic anemia, which is rare complication, which is mean suppression of the bone marrow. Rare other complications, myocarditis, parotitis, and orchitis. Thank you. I finished my lecture. If have any question on this lecture?
بس إذا ممكن تعيدين diagnosis مال HIV بالانتيبودي.
Okay. بالنسبة لل HIV antibody، إذا كانت الأماية مصابة عندها HIV infection already راح يتكون عندها بالبلاد antibodies، فهاي الانتيبوديز راح تعبر عن طريق البلاسنتا إلى الطفل خلال الحمل. After delivery at birth أريد أعرف هذا الطفل هل هو مصاب من الأم أو غير مصاب، لأن ممكن يطلع غير مصاب. إيش راح أسوي؟ راح أدزه antibodies detected ال HIV antibodies in the blood of the child. إذا طلعت لك الانتيبوديز بوزيتيف هنا، يا إما هاي الانتيبوديز هي transfer from placenta to the baby ممكن، وممكن لا هو الطفل infected أصلاً وتكونت عنده الانتيبوديز. طبعا هذه الانتي بودي اذا كانت عابره من الام الى الطفل عن طريق البلاسنتا تاخذ وقت تقريبا 18 مانث وبعدين decrease and disappear. فحتى اتاكد انه هذا الطفل هل هو مصاب، يعني هذه الانتي بودي الموجوده عند الطفل هل لانه مصاب وكون انتي بوديز او انه هي لا اجت من الام وعبرت عن طريق البلاسنتا، لازم اعيد التحليل after 18 months. اذا لقيت الانتي بوديز الاتش اي في انتي بوديز still positive in the blood of the child this means it is infected. لا اذا لقيتها it will negative after 18 months معناها الطفل غير مصاب، هذه مجرد انتي بودي عبرت من الام الى الطفل. اذا اريد اتاكد يعني انا خلال هاي ال 18 months ما ابقى انتظر سنه ونص حتى اتاكد الطفل مصاب لو لا، تريد تتاكد 100% تسوي الاذر انفستيجيشن اللي ذكرناها، ممكن اسوي بي سي ار to detect الدي ان اي او الار ان واسوي الكلتشر فيرال كلتشر to detect it is infected or not. واضح؟
واضح دكتورة، شكرا جزيلا.
Another question طلاب؟ Okay, if there is no question I end my lecture. شكرا جزيلا.